first and foremost, I want to thank everybody for coming out to our presentation today. We are humbled and grateful to have the opportunity to speak to you all. Our presentation is going to be on connecting substance abuse treatment to recovery. So by the time we're done our talk here, we would love for you guys to have an understanding of what treatment is, substance abuse treatment, and what recovery is, because the two are absolutely different. And we're also going to talk about how to bridge the gap and connect treatment to recovery. With that being said, my name is Greg Wright. I am from Wilmington, Delaware, graduated from Brandywine High School in 2008. I went on to the University of Delaware, and I also served 4 years in the United States Navy. I have personal and professional experience in the substance abuse field and recovery. I am a man in long-term recovery myself. I work for Banyan Treatment Centers as the alumni coordinator, and I also work for Community Collaboration of Delaware. I do some outreach and admissions things with them, and I also am heavily involved in the Delaware recovering community because I am a man in recovery.
Hey, thanks for coming out. Thanks, Greg, for opening. I'm blown away in gratitude. My name is Zachary Viv. I'm the youngest of 5. I'm a lifelong Delaware resident. Every member of my family is either in active recovery, addiction, or no longer with us that succumbs to the disease of addiction. I have a long experience with the criminal justice system. At the age of 11, I started getting locked up. At the age of 14, I started getting sent away to CBT programs as a juvenile. South Dakota, Chamberlain, South Dakota, one of the best CBT programs, loving CBT programs. I've been to cognitive behavioral therapy, press program a couple times in the state of Delaware, years behind the wall, incarcerated, and 20 years in active addiction. In that time in active addiction, I was on the methadone clinic for 3 years. I was on Suboxone back 13 years ago, and I ended up going into prison for the last time at the age of 30, and that is where I got clean. I had task supervision. I had the Division of Substance Abuse and Mental Health, DSAM, had a program back then 12 years ago. It was called Gateway Foundation. A lot of people got court mandated. It was abstinence-based, and it was recovery-based. It connected treatment to recovery, and that program helped save my life. The last 6 years, I've been clean 12 years. But the last 6 years, I've been in service heavily. I help write curriculum. We advocate for recovery. I serve inside treatment centers and consult on different curriculums. And I'm overall a recovery advocate for the state of Delaware and trying to help treatment centers better connect people to recovery.
My name is Matthew Anderson. What he left out is he's also the president of Fern Foundation and does a heck of a lot of work in the community in our state. Tons of work in our community, a lot of community events. He brings a lot of things to our state that we didn't have prior, which is amazing. Again, my name is Matthew Anderson. I'm a certified peer recovery specialist. I also have a lot of experience with interventions, educating the general public on what we suffer from, to try to give them a better understanding on how to be more effective with us, and of course more understanding toward us. And I also am in recovery. I spent most of my life in the streets or in prison, about 15 years of my life in prison altogether, involved in the drug trade in one form or another, usually using and abusing narcotics. I could not stop. I've tried every means to stop. I've done everything from having a girlfriend to moving away to trying to have a kid to stop. I've tried different medications, Suboxone maintenance. I've tried going to the prisons, educating myself. I've tried every possible means that I could possibly think of as far as like outside of myself to stop using and abusing drugs, and I just could not. I had an experience with recovery which was different from the treatment because I always thought the two were the same, which is kind of what our talk is going to be on today, but that is really what happened to me. I finally, somehow along the line, I knew that just physical separation wasn't enough for me, so I ended up going to a rehab. I got involved with people that have actually suffered from the same things that I have and recovered from the same thing that I had, and they educated me and took me through a process of recovery, which is, for the most part, 12 steps, for me. And it's usually 12 steps for a lot of people in recovery, and it has absolutely changed and saved my life. Now I work in the community. I do everything I can. I have a place in Florida. I live in Florida, but I'm here in Delaware to try to be of service to my community. And that's my amends to the community, as a lot of you guys that are Hero Help and things like that, and NAMI trainings and stuff that I do, know that I'm here to try to be effective to my community and nothing more. I appreciate you guys for being here, and it is an absolute honor to be able to be of service to my community instead of tearing it down.
So just to reiterate, there is a difference between substance abuse treatment and recovery. If you look up the definition of treatment, it actually involves medical professionals helping an individual get physically separated from the substance so that they hopefully can participate in recovery, right? And recovery is about healing the things that cause the individual to need treatment in the first place, right? Recovery involves not just the drug and the alcohol use, but it also involves dealing with behaviors. It involves dealing with emotional trauma. It involves dealing with the whole individual as opposed to just the substance use disorder, right? So that's the difference. Now we're going to go into some questions.
So, give an honest assessment of the substance abuse treatment currently available in Delaware.
So, we do have treatment options in the state of Delaware. We have detox facilities. We have residential treatment facilities. We have sober livings that are popping up throughout the state of Delaware, which are actually vital in connecting treatment to recovery. One thing that I will say is I would love for treatment centers to do a better job of informing their clients on the difference between treatment and recovery. A lot of clients come into a residential treatment program and they believe that at the end of that program that they're going to be cured of their drug and alcohol problem. And that's just not the case. So I would love to see more treatment facilities educating their clients on the difference and helping facilitate them getting connected to recovery via sober living and things like that. And I work in the field, and we do have excellent case managers out there that try and do their best on bridging that gap. But because the education is lacking on why it's important, sometimes it's difficult and it creates a barrier.
Yeah, my assessment would be we have to go somewhere that we get a gift of desperation, we surrender to a point, we usually go to detox, or sometimes treatment centers have a detox, but when you zoom out and look at how treatment used to be and what used to be available and what's available today, it's a direct result of finances, the cost, right? And everybody in this room knows the cost dictates your level of care, right? And when you zoom out, whether if you're a for-profit, 10 years ago, long-term treatment was considered 4.5 months to a year. That agreed with the brain science of the disease of addiction. It's physical, mental, and spiritual, right? So just physically, our level of care in the state does not agree with the level of care that's needed. So what is available is radically shorter than it takes your brain to heal. Now, when you get into these treatment centers, they're not abstinence-based anymore. So they treat you, and there's no path, right, to the next level of care that encourages you to pursue recovery, because recovery is available to all. What it creates is more of a person and treatment reliance, which is good for economy, and it's good for the economy of treatment and to be profitable, but is it good for the individual to connect them to recovery that is available for everyone? So it's not the treatment center, it's not an MAT provider, it's not the courts, it's really the overall, the way the money is distributed. Even in the nonprofits, the money you have to, when you write on a grant for a nonprofit, if you want to offer an abstinence-based stream to have everything available, like Samson says, equally, you can't get the grant money to do that. It's almost impossible. You have to conform to the culture in which we're in today, and it creates a recidivism rate. I know that's a popular word, unheard of. In jails, institutions, treatment centers. We go to some treatment centers, we serve in treatment centers, we go out and meet them there, get them connected to recovery, and they go back in and serve. Sometimes I gotta say, yo man, you don't work here? They've been in that treatment center, $30,000 for $35,000 for 30 days. It's not the treatment center's fault, it's the culture. And I gotta ask if they're staying. They've been there 8, 9, 10 times. So it turns into a business instead of what's best to connect them to recovery, to have something available that can help them. In my personal experience, I got the level of care free through the state of Delaware 12 years ago that got me away from the substance, absent for 9 months before I returned to a sober living home. And it was very productive for me.
We would love to see more long-term treatment options out there. There aren't very many long-term, 90 days and more treatment options out there, and that's what's agreeable to the brain science behind substance abuse. Our brains can't heal enough from detox to 28 days. Our brains are not healed enough to absorb the information we get from treatment and utilize it in an effective way. That's a long way of just saying these people that are coming out of treatment facilities, they can't make decisions for themselves. It's physically impossible for their brain to make healthy choices for themselves. And we wonder why they get out and they can't stay clean and sober. We need more long-term treatment options in the state of Delaware.
Before I go into answering that question, I think it's important to let you know why I'm going to answer the question like I am. So, being a recovering drug addict and alcoholic, something happens to us that doesn't happen in a normal person. Now, somewhere along the line in our drinking or drugging career, we have crossed this invisible line. I've actually done a training over there at Hero Health with Jason and them one time, and it was very beautiful of what transpired in that room. And this is what I try to educate people on, to let them know what we suffer from, because sometimes I forget that you guys aren't us, you know, and you just need some more understanding on how to deal with us. So what happens is, when I put a substance in my body, I react differently than a normal person. I don't know when that happened. At some point, I used to react normally, as you guys did, you know, and you might have a drink at the table and that's okay, or red wine with dinner and things like that, but that doesn't happen for me. Somewhere along the line, I crossed this invisible line where when I put a substance in my system, my body just tells me and craves more. All I can think about is more. Nothing else matters to me. Nothing else is more important. Children, jobs, employment, it doesn't matter if I have to go to work. It doesn't matter if my wife is calling. It makes no difference on what's going on. My brain can think of nothing but more, the next one. That's the physical component. I would tell myself millions, I've been in the prison system most of my life. I would go to prison, I would say, I'm done, I swear I'm never, ever going to do this again. And I meant it. You could hook me up to a lie detector test. Every fiber of my being told me I am not going to do this again. I swear, and I meant it. There was times I gave the rest of my substances away. I am done. I mean it this time. This is it. And then I wake up, and my bones are crawling out of my skin, and my body is craving that more again. That's what happens to me physically. But mentally, which is where the problem is and what we suffer from, which is so important to be discussed, is when I go to prison and I get physically separated, and I'm not talking about, and I will get into that in a second, but now, like, you can go to prison and they'll give you narcotics. Suboxone and methadone is a narcotic. That's the facts. So they'll give you a narcotic in there, and that was like the only place back in the day that I was able to get physically separated from the substance. I wasn't able to get physically separated anywhere else, because I wasn't. If I've been a detox, I've actually hopped we have a place called Kirkwood Detox, and I hopped the fence at Kirkwood Detox. And the second time I went in there, it's like, Matt, you know you can just like walk out, right? So I escaped from places that I can absolutely walk out of the door of. But completely sober, I would get out of rehabs, detoxes, whatever, therapy, prison usually for me, right? And I'm completely physically separated, which means I can pee clean for the PL. I'm always on, and it's not my behavior that makes me an addict. It's the allergy. It's that craving for more. My behavior, some people's behavior is just steal stuff. My behavior takes me to violence. So when I go to violence, I end up in prison, incarcerated for years at a time. So I get out of prison, and if you're incarcerated for a violent crime, you're on level 3 probation when you return. And on level 3 probation, as most of you might know, you're going to get a urine analysis. And when I run in for a urine analysis and I'm sitting there, I'm talking about, I'll give you one specific example, but there's hundreds of them for me. At one specific example, I would tell myself, I'm going to go in here, I'm going to pee in this cup, and then I got 7 days before I got to pee again. And I believed the lie that I told myself that I already failed that hundreds of times. I have all the consequences in the world. I've been dead at every hospital, from Good Samaritan to Cooper Union, from West Palm Beach, Florida to Camden, New Jersey. Dead, flatlined at all of them. I'm going to lose everything. I'm definitely going to jail. And yet I tell myself, well, I'll just do one. And then I'm unable to stop. So then I'm lying and being dishonest with my PO, and I can't, I'm trying to, I'm buying Wizinators and things like that, and some of you guys know what they are. I'm doing all these crazy things to try to pass my urine, like wear tracksuits and drink kale drinks and all this stuff, and I can't stop. I can't stop. That is what we suffer from. So how do we heal from that? I can promise you that it's not a 30-day treatment center. Not saying anything bad about the treatment, because we do the best we can, and often, they'll keep using this description of evidence-based, We always say evidence-based, but no one talks about the evidence of the 12-step fellowship and how we can bring that in. And you can't, because it's an anonymous program. However, no one can deny the fact that the 12-step fellowships are the most effective way to help people like us, and that is the fact since it began. Matter of fact, it was the facts before a 12-step fellowship, when it was a 6-step fellowship called the Oxford Group. That's the truth. So how do we get people more engaged in that? We can't continue to give them medication and a narcotic and to come here and take this drug to get off of this drug, and then when you get, and we all have, there's 3 people up here that have experience with MAT, and I promise you, I don't know anyone, and I'm telling you, I'm deep in the recovery field. I don't know anyone that's on it, and if I believe in MAT to a certain extent. If you're going to use it because you don't want to stop using drugs, then fine, you should be on it. But if you want to stop, doctors in the treatment center should not be pushing it on other people. They shouldn't be saying you should continue to do, hey, you should take this, you should, because they have no experience. They have no experience. That's not a part of recovery. If someone is telling people, I don't want to be on this substance, then let them get off of it. Do not try to push it on them. Because I've used drugs and narcotics on MAT every single time I've been on it. So our biggest issue, and I had to explain that to you before I really got into answering the question, is we don't have long-term treatment in our recovery, and we don't have an abstinence-based program. I mean, complete abstinence-based, no MAT, no nothing. And we have one called, we had a really good program, and it's still here. It's called the Lyman House, and the Lyman House really does some step work. CCD houses do step work. These guys are like in 12-step, they're like 12-step based programs. And that's the bigger part. So long-term treatment, abstinence-based treatment, and also 12-step based treatment, which will be more effective to our state. Not just to our states, but to our families, to our communities. It will help absolutely everyone. Because when you've got people like me who destroyed our community, and Greg and Zach, who literally destroyed our community, and then we recover through this spiritual program of action, right? Which is, all that's a part of it though, physical separation and all that. And when that happens to us, all of a sudden we're back in our communities, helping other people and doing stuff that nobody else can. So now we're working hand in hand with, I'm working hand in hand with Jason and probation office and law enforcement and the medical community, people like us, and it's just amazing what will happen if these things were to happen in our state. We can have a profound impact if we had long-term, abstinence-based, and also 12-step based recovery centers in our state.
Just to highlight what he said, if one is to go out and experience a fentanyl overdose, and this individual is taken to the hospital staff will get this individual's vitals stable, send them home. No matter how many times that individual has come into that hospital and overdosed, the only thing for them that they can do is get their vitals stable and send them home. But if you take that same individual, this same person, and put them with a community of other recovering people, not only will they stop using substances, but they will become contributing members to their communities. When you heal one of us, you're healing families. And when families get healed, communities get healed. And we can't afford to be in denial about the facts of what's going on in our state. We love our treatment centers. We serve in our treatment centers. We work in our treatment centers. We love them because they provide a space for individuals to get physically separated from substances. But one thing they cannot do is take an individual and carry them through the same process that we've all been carried through that has been proven to be effective. How is it proven to be effective? We measure our effectiveness by service. A person in recovery is going to be of service to his community, period. And I know a lot of people like statistics, and it's pretty on paper, and we can say this percentage of person is healing or whatever, but we measure our recovery process and our level of recovery by how much we are contributing and giving back to our communities.
Before we move on to the next question, just the assessment. When you go in, and these are some of the most educated people, depending on where you're educated, and they know the brain science. There's a lot of mixed messaging that goes on, like the word relapse. You don't ever get abstinent, you can't relapse. If I'm on a narcotic, whether it's prescribed or not, I was prescribed opiates, did other drugs, they didn't say it was a relapse. When we come into treatment, we're broken. We're looking for guidance, direction, authentic love. Treatment center I was in was consistent. Couldn't smoke, couldn't hurt yourself, and we hated it in the beginning. But we were looking for a change. When we go into any treatment setting now, it pains me that they're not educated on what that human body can absorb, like Greg said. The first 30 days, especially if they're on a narcotic and they're stable, they're not shooting heroin or they're not shooting fentanyl or xylazine, whatever it is now. But the message isn't like, okay, this is stabilizing you. You're going to have to continue to get abstinent to get into recovery. The line is so blurred, it's confusing. It's a mixed message. No matter what narcotic is, physically it hurts your body. And that is unescapable, right? So when they're in there and they leave there and they come into a community of recovery, we're the bearers of the good news. We have to tell them, hey, we love you so much. Recovery starts when you get off of that stuff. That person has to go back to the treatment center once they agree with that, the truth. They have to go back to the treatment center, get off of the drugs that they were helped with, to come back into recovery. And we've seen hundreds of people over the last year start to tell that testimony in the community. Restart their clean time. They were never clean in the first place. And what happens when someone relapses, which isn't a relapse, it's called they use more for the internal problem. Some of them are dying. If we did the autopsy reports and got the medical records for the ones that died, the 500 some last year, guaranteed a lot of them would have maintenance drugs in their system. I'd venture to say a very high percentage. And if you're in the field working criminal justice, you know exactly what I'm talking about. It's frustrating, isn't it? Very frustrating, right? So we need a place, like Matt said. Stop using the separating terminology. Let's say a consistent message of love. Or when they're ready, there should be something available, right? And the reason it's not available is because the funding isn't available. So what we do as people in service, inside and outside, we galvanize the community. We educate them. Churches, right? Businesses. If everyone in Delaware donated $1, we would have a 54-bed facility free, constructed in 6 months. Because we can't get the sustainable money to sustain a facility because we won't take state funding, because we won't compromise recovery. And everybody goes, well, why aren't you guys open? Why don't you have this facility? Because the community isn't participating. And in recovery, we heal in community. We grow in community. It's proven. Them things they were teaching earlier today, community, 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 family, community, community. That's what recovery is. We're reborn into a truthful, loving family. And when I came through treatment 12 years ago, they told me the truth. It was my underlying trauma, and it hurt healing. But it was necessary, you know? So when we go in now, they try to tell them they can do all this stuff in 30 days, and they know they can't. They know the body can't do that. The brain can't do that, especially when they're on a substance. And they're like, what's wrong with these people? Why won't they stay in treatment? Because they're not in charge of the controls of their body. You know? They have no control.
I was listening to the last presenter, and I'm not sure what her name is, but she's a doctor, And she said when people are in active addiction, they lose executive function.
Executive function. Control.
That means they lose the ability to make decisions for themselves. Something else is making decisions on behalf of the individual. And what that something else is that driving force that's causing them to abuse substance in the first place. What recovery does is it solves the root cause of the problem. It heals the things that cause this individual to lose executive function. They gain executive function back. That's what that's about. And it's scientifically proven. That's what their presentation was on. I believe it was the second presentation of the day.
Greg made a good analogy last night when we were talking and discussing this panel, and he said, this is the truth. Someone who has cancer, right, that is continuing to go through chemo is in the treatment. They are treating cancer. But someone that has beat cancer and is in recovery from cancer and readmission from cancer is not going to chemo. They're not continuing to go to chemo. So there's a lot of things that happen in our state, and this is the truth of the matter. The lie that we tell ourselves in the physical part of what an addict is, right? So if the most important part to acknowledge about an addict or an alcoholic is the fact that we lie to ourselves to convince ourselves to try one again, and then which releases this obsession for more again. But I lie to myself to convince the first one, and that is the disease of addiction. What do we do about that? I'm just telling the facts. I'm here to present the facts to you. There is no human power for that. There is no human power, no medical community. In fact, we had doctors like Dr. Silkworth and Carl Jung, one of the most educated you're talking about like godfathers of psychoanalysis. These guys, you're talking about working hand in hand with like the most educated people on the planet. And he told us that there's nothing that we can do for people like us. They called us hopeless. They actually used to try lobotomies on us and electric shock therapy to try to get us to stop. There hasn't been an effective way to get us to stop more so than a 12-step based fellowship, right? Than any other thing. So the fact is, if I suffer from this thing and I lie to myself, and there's no human power, no doctor that can help, there's no doctor, I don't care how educated you are, or how many groups you've done, or how many degrees you have, when I'm in the parking lot of probation and I tell myself 7 days, you're not going to be there to help me with that. I need something spiritual to restore my sanity. And which is what recovery is really about. It's spiritual healing. It's what it is. And we're not talking about spiritual as far as religious goes and go to the church or anything. We're talking about a spiritual program of action that helps me connect and communicate with God. Which we all know God exists. Rather you do or not is up to you. But the fact is, I can say this. When I was a child, and if you have this experience, I would love to see your hands. When I was a child, I used to steal. I was a thief, right? But whatever it is you did something wrong. And when you did it, something inside you said, don't do that. Remember that? It was like a loud, audible voice when we were children. It was telling me, like, this is not a good idea. That was God directing me. Addicts have shut that down. And what we do is we work this program of action to wake that back up. And when we wake that back up, we're starting to be, I'm not worrying about me and my new car and a new job and where am I going, getting this one or any of that stuff. I'm worrying about how can I be effective to you? How can I help you? I need to make you an amends to you because I caused you harm. I should have not done this. How can I correct it? We become like outstanding citizens, so to speak. It's unbelievable.
Thank you guys. Thank you so much for all that. That was great information right there. All right. We're going to move on to the next question. What barriers to recovery exist within substance abuse treatment in Delaware?
So in my opinion, the main barrier is lack of education and misinformation about what recovery is. As we just described up here, recovery is absolutely different than treatment. You get treatment in a controlled environment where we're getting clients physically separated from the substance. So if a client goes into a residential treatment program and they're under the impression that they're going to be okay after they discharge from this program, they have no incentive on continuing this process and going into a recovering community, because they believe that the fix was in treatment. So we have to start better educating individuals when they come into treatment and let them know that this is not the last stop. You don't just take this pill here and you're done. This is a program of action that's going to take your participation if you want to continue to recover in this process and live a prosperous life. It does not stop at the treatment facility. Even if we had long-term treatment facilities, which would be great, they would still have to come out of that program and choose to participate in their recovery. And it starts with providers in these facilities letting them know the truth. I have a personal experience. I went into a treatment facility when I was in active addiction. And my goal going into this treatment facility was to be absent. I went to treatment wanting to come out of treatment absent. Because I was so beat up and broken down from substance abuse, I went to see the provider to consult with him, and I told him I wanted to be abstinent, and he encouraged me to get on another narcotic medication. That's a barrier to recovery. Because now, my goal, I was going to go along with whatever they told me to do, I was going to go along with it. Just like when we're sick and we go to our primary care physician. Whoever's in the white coat and has been educated for 7 years, we're going to go with their opinion because they're a medical professional. So if I'm beat up and broken down and I walk into a treatment facility, I should be able to trust that the guidance I'm getting is going to be in my best interest. And it's absolutely not in my best interest to be on another narcotic medication for a long-term period. Now, I get it. If there's a plan at some point in the future to come off of this, okay, fine. That's what treatment is. That will be in this individual's treatment plan, and once they come off of this treatment protocol, they can participate in recovery. But we have to understand the difference.
The documentation and oversight of treatment centers and who's documenting and what theology is. With the example Greg gave, great example, we see it every day. Every day. Now, when I express a desire, that's not coming from my disease. When I say, hey, I want to stop using, I didn't take myself to the treatment center. Something intervened for me. Whether it was prison, right? I could never surrender. Prison. God put me in prison, right? So I could get off. But when I express a desire and I'm in a facility that's responsible for human beings and calls me their patient or their client, they're people. And when that person expresses a desire to stop using substance, and the person responsible for their care says, why? Why do you want to go? I often hear this example in substance abuse treatment. It's disease. And they use diabetes as an example, or heart disease. Now, the medications for diabetes and heart disease, they weren't born on these medications, right? And if you're naive or you're uneducated about the disease of addiction, you might say, well, it's a disease. They need that medicine. It's a life-saving medication. They weren't born needing diabetes medicine or heart medicine. They were born operating somewhat normal. You won't find one person that's born on a narcotic. And if they are, they detox that baby and get that baby to normal operating procedure. But the woman who has the baby, they keep her on treatment. The person who expresses a desire to stop using substance so his brain can heal in 9 to 12 months, right? And can grow and understand what it likes and doesn't like as a human being in recovery, it's blocked, you know? So there's a lot of barriers.
I know what it sounds like. I know what it sounds like, you know? You got Dr. such and such, 17 degrees, years and years of education. You know what they're talking about. They studied it, right? They've gotten all these this evidence base from the same people supplying the substance, you know, that are giving them the evidence. That's where we're getting the evidence from. We have all this evidence base, you know, of this stuff working. It. This guy's, you know, look at it. He's never been in trouble. He's been a outstanding citizen. You know, he's a doctor. He's a very educated doctor. He does all type of TED Talks and everything, right? And then you got Matt and Greg. You know, let's just say me. You got Matt. 17 years of his life in prison, destroyed his community at one time, was causing a ruckus, was actually an animal inside and outside of every institution he's been in, uneducated, only a CPRS, years of education, convicted criminal. I know how it sounds, but we have experience with how to help people recover. And I'm not saying this egotistically. I could fill this room up with people that I've taken through the work since I've been here in the last 2 years. And those people can fill this room up with people that they helped. And then eventually those people will be able to fill other rooms up with people that they helped. And the truth is, even though I'm uneducated, I have an experience. It's kind of like this. My brother, right? And I used this analogy before when we did one of these talks. My brother has end-stage liver failure, dying, kidneys are shutting down. And it's really what brought me to Delaware is to try to give my brother a partial transplant because we have the same blood type. So he's going to the University of Maryland. He's getting all these workup. They call it a workup, right? And he has to do all these stress tests and things like that before I go and get my workup done to see if we're compatible, and then I can give him part of my liver. It's crazy because they take 60% of my liver and it grows back in 2 to 5 weeks. So I'm trying to give my brother this process. However, my brother has a double hip replacement, right? Lost both femurs. This is what alcoholism has done to my family, not including what I've done to my family, but what to my brother physically, right? He has no idea unless he's had a hip replacement. He can tell me what he read and what he thinks and what he knows and the evidence that was given to them by some people that have no idea, no experience with it. An experienced member. It's like a doctor. Hey, do you want the doctor that is 20 years of education, right? He got 20 years of education. Do you want him working on your knee? Or do you want the guy who has 20 years of experience and 4 years of education working on your knee? Just here, I just did a talk for the University of Delaware over here at Gander Hill Prison. We had the graduation of the Inside Out program. And I was talking to the warden over there, Emmett, who I actually grew up with in prison. And now he's the warden there. So I go and I give this talk to the keynote speaker over there. And I got to talk to Emmett. I'm like, Emmett, what can I do to come in here? What can I do to serve my people? These are my people. I want to help these people to never come back here again. And I feel like we could be effective at doing that if we were just given more. This is one of the biggest barriers. If we could just if you guys and other people could help us to get into these places. And I'm not talking about people to make sure there is much more important for me to watch my community recover than it is for me to make any amount of money. That's the truth. That's the truth.
You said we're uneducated. I beg to differ, brother.
Yeah, you are educated.
So listen, when it comes to recovery, you'll come across. We have lived experience in active addiction, and we also have lived experience on making it to the other side. Truth be told, we're the people you want to talk to if you have a family member that needs to get into recovery. Because said it out of his own mouth. There is no human power that can fix what these individuals have going on. Well, what is human power? That's medication, that's psychiatry, that's everything that we can conjure up from a human being. It's not going to be effective. But there's evidence, and it sits right here before you. There's evidence that participating in a program of action is the most effective way to make a full recovery from substance abuse.
And real fast, we're not just talking about the people that, because there are people that medication could possibly work for, right? That just aren't like us. They might have used a couple times, right? And they don't have the same thing I have where I lie to myself to convince myself to take more. We don't want, I want the people, we want to help the people that are broken, hopeless, the people that everybody, including you and mom, and everyone else gave up on. We want them people. They're the people that we can help. The people that nobody else can, the people where everybody's like, yo, this dude's done. That's it. That was me. That was me. We want those people because they're the people that are lost and broken and desperate for more, the better off they can get.
So the barriers, the solution is already there. When you go into treatment, there's programming and medication. If they would keep programming and medication separate and let the clinical people do the medication and let the programming be the programming in a facility, they underestimate the power of recovery. It's when you mix them together. I won't name any organizations. Banyan is that aren't doing well, but Banyan is one of the models for a 30-day treatment center. They let the recovery community in since their inception down there in Delaware. The church is in there. The community resources available. They support community. You know, the same principles we practice in recovery. If the facilities, the greed wasn't there, if they gave back to their community, if they role modeled, if they opened doors, recovery is that powerful. The prison system, we serve in the prison system. When you go into the prison system and the same officers in the prison system that knew me and Matt when we were in there say, yo, it's worse than it's ever been. That's a bipartisan opinion. You know what I mean? They're just working. You know, they don't have any investment, stock, and trade. There's going to be people that light's going to be on in prison no matter what. You know?
And if these medications were working, then why do we have more ODs and deaths than ever before? Not just here, but across our entire nation. Why is there more ODs and deaths than ever before if these things are working? If we are being effective, then why is this happening?
So that's the barrier is we had a talk. Somebody came to the talk that was a politician last year. It was unheard of. We had politicians and people in the field and people in recovery together. Their job was to get humble and just listen to the people in recovery, right? They came, we said, just introduce them. They sat up there and talked for 20 minutes before they introduced somebody about how great the state of Delaware is doing. We suck. We need to get better. Like I'll tell you right now, I need to do better. Like everybody I've ever come in contact with needs to get better, needs to get humble, right? Need to do the best we can what we have. What I'm saying is, what's going to do better, the barrier, is when we come together. Like, some places you just can't get into, because it's them and us, you know? And even this talk today, you might think, well, there's division. No. It needs to be inclusion. I was telling Penny earlier, I'm like, hopefully one day we're all at the same table, with the same motive and want to help people. But when we go in and talk to people, it's like, in treatment centers, it's like, hey, we sit down with the clinical director or the programming coordinator, and we go, hey, do you guys really care? And they go, yeah, we really care. And then we start asking questions about mixed messages, groups, how there's so much effort to connect them back to treatment, but there's little effort to connect them to community resources of recovery, right? And to help them bridge the gap to get off of something into recovery. And it's created a culture. It's a barrier to recovery when they tell people that treatment is recovery. You know, treatment is not recovery, it's medical. Recovery is, you know, getting something back lost or stolen. That person's worth is who they are, regardless if they hurt themselves in addiction, doesn't change their worth. You know, when they devalue their stuff, it doesn't change their worth. They're still worthy people, they're still great people, they just don't know it. That's why they're hurting themselves. And the messaging we send them through action is powerful in treatment centers. I mean, it's so powerful, and when we just have something, we're not asking for this to change. We accepted the fact as a state that treatment is treatment. But in the last 10 years, and I'm not talking about 20 years, I'm not talking about 50 years, I'm not talking about 100 years, I'm talking about in a 10-year period, especially the last 5 years, the culture shift in our state of Delaware to call treatment recovery and then deny the adverse effects of doing that is insanity as a culture. And we are responsible for other lives and other human beings. We need to start being honest about what's going on, right? If we can't identify the problem, we've got some intelligent people in the room. We can't come up with a solution.
I have a quick question comment. I totally get the presentation and the struggle. Pandemic has definitely hurt the 12-step community, being present in different facilities across the state. There's hospitals, treatment centers. Studies show that 12-step programs with treatment are better than not, period. So a valid point too. Conflictual point though, medication-assisted treatment, the same studies show that the first year of treatment, that people that don't use the treatment have a higher rate of death than people who do, right? So we're really talking about here in terms of mixed messages is treatment choices. Person coming in has true valid choices of medication-assisted treatment or not, risk benefits, honest discussions, true transparency, the access to that data of the risk and benefits with medications, without medications, the short-term view, the long-term view. Now, the funding part, the first, month, sure, people love funding choices for a month, 2 months, 6 months. Cadillac services, great. That is a separate conversation, but I'm more focused upon the getting well conversation as to what works. The 12-step programs works for most people, but not for all, because many people just won't buy into the 12-step treatment program, the higher power, the spiritual foundation. So I think your presentation really providing us the complexity of what a client faces walking in, from different messaging from the rooms, from their family, their friends, the clinician, the payer sources. This type of dialogue is great because it brings us to the same table. I just get worried if a physician is pushing a person towards medication and a 12-stepper is pushing a person away from medication that might save their lives.
You've identified the biggest point, and this is the biggest barrier, God is so good, because treatment and 12-step are in direct conflict. But even treatment centers, any treatment center you go to, you'll never get a person leaving, Jacob's leaving. I'm never going to say, don't go to a meeting, don't get a sponsor, don't go to 90/90. No matter what their theology, all those factors you mentioned, they understand the power of recovering people, right? So the thing is, we used to go in treatment centers, and I didn't mention this. They would give you a big book and a basic text. You know what we do as a foundation? We fundraise to buy literature. You know how much they charge for urinalysis and treatment? $1,600. You know how much a big book costs? $1. And you tell me that's not a barrier to recovery? That they're not pushing an agenda? Come on, let's get real in this room. Let's get honest. Because the agenda is keep the economy going at the sacrifice of my family, my friends, my community. Now listen, this is personal to me. Okay, I grew up down the street. I got people dead and gone. I just left the treatment center yesterday. I got 3 other people in there on their way if they don't get connected to recovery. So if everything's supposed to be available equally, where's the oversight?
I have to say this, I understand where you're coming from, and you're correct. However, me, right? Let me ask you just a question. Have you ever done any medically assisted medication?
No.
Okay. Do you believe that it would knock your socks off if you used it right now?
Yes.
100% it would. It's a narcotic, just speaking for me, if I were to put Suboxone into my system today, and this isn't a debate about, because I believe if you are harm reduction, if you're going to continue to use and you have no inclination to get off of substances, then yes, you should be on medically assisted treatment. Back in the day when it did first come out, they gave it to you in detox to get you through the detox procedure, and that was it. They shut it down. Now it's on it for years and years and years and years and years and years. If I were to take a piece of Suboxone now, go to treatment now, this is me, an experienced member of narcotics, I would die within a week. I would be OD'd or flatlined somewhere in the community because it would release that allergy, because that's what we're treating. That's the point. And a lot of people, are objectionable to 12 steps for a while until they get beat. Me too, because of the God piece. Because I was beaten into a state of reasonableness, right? And the truth is, I didn't have no other answers. And if I had the power to stop, then I would just stop. If I did not need a greater source, right, or any of that matter, or I did not need a community of people, I would just make a choice to say, you know what, I'm done, I would stop, and that would be it, and I would never return to drugs and alcohol again. I do not have that power. I need it. And I need to stay connected to it in order to keep it. And I also need to give it back, in order to keep it. So I understand what you're saying. It's not that we're saying that no one should be on MAT and they should eliminate it from the planet. That's not what we're saying. But there is, and also I would like to mention this. People that are on these substances, the doctors are not, and the facilities are not. I'll give you an example. I'm not going to mention the facility. I went into the facility and I said, hey, and they're showing us the methadone, tables, and hey, they go up to this window and this and that. And I said, he said, do you have any questions? And I said, yes. My question is, what happens when someone gets a dirty urine?
Good question.
And he said, well, we continue to treat them. They don't document how much they're continuing to use drugs. I understand you think that they're not, but they're not documenting how many people are on substances while on the MAT. That's the truth. There is no documentation on it. And then they continue I said, well, what if they get 2? And he said, well, I mean, case to case, but we'll still treat them. I said, what if 3 or 4? And he said, again, case to case, we'll still treat them. I said, at what point do you think that this is not working for them? Let's try something different. And then I said, I have another question. Do your doctors, if someone comes in here, like say me, for instance, and I say, I want to be abstinence-based, do your doctors say, no, I think you should take this? Or do they support the abstinence-based? And even in the facility where I just spoke at, one of the correctional officers informed me that they do MAT so much in the prisons because they get paid for it. That's the truth, man. You have big pharma, and I'm just being real, man. You got big pharma, you got sued for billions and billions of dollars to put back into the community. They gave it back to the state along with some paperwork with evidence based on it to do MAT so we can all put the money that they just gave the system right back into their pockets again. That's the facts. People are dying. And if it was working, why are we still here? If it works.
Thank you, Matt. Thank you.
It's cool that you shared that, because it goes right along with the next question. What can substance abuse treatment providers do to help connect men and women to recovery? And basically, this gentleman said it. He said that they need to present their options in an honest way. That's what I got from the sheriff. We're not saying that MAT is the devil. That's not what we're saying.
Not at all.
The only thing that we're saying is it's not.
It's treatment.
It's treatment.
Not recovery.
And if it's treatment, it needs to be included in the treatment plan to talk about how are we going to transition this individual from treatment to recovery, because there is a difference, as we now know.
I have a question.
Absolutely.
So, here I have somebody in treatment, they were released from prison, couldn't go to sober living because they were on MAT. We're talking about during the pandemic, therefore they ended up homeless and ODing. It was one of the hardest things for me to see, because I knew how hard they worked while being in the facility. But as you said, you could be sober in a confined environment. It's when you get outside and you have all the triggers around. What do you say then to bridge that gap? Because of course, it's like sudden now. I'm getting released and I've been dependent and I'm scared now to come up at MAT.
We do. We have combined that now. So Oxford houses are accepting of MAT. We have a place called Impact Life that accepts people on medically assisted treatment and also tries to connect them to recovery. So it's not just connect them, but also to let them in the house and then connecting them, taking them to meetings, things like that. We also have, I think, Lyman House is also under that, trying to do that as well. And we also got CCD houses, the Community Collaboration Program, that also accept people. So that is not I don't know, but people, an addict can tell you, oh, I can't find nowhere, you know what I mean? But there's definitely places for them to go.
And I'm a person, like, what can they do? They're doing it already. I'm an advocate for recovery, 12 steps. Everybody knows that. I'm an advocate for God. Everybody knows that. I don't pull no punches. That's my story, right? But I do know how long it takes sometimes for people to come around to that. But I do know, and I do believe in the power of recovery in this spiritual program. So Impact Life, CCD. CCD is a phenomenal program. They're a mixed crowd. So it's a lot of other recovery homes that the state gives money to, right? And they can provide free residences, right? And they have MAT available, they have all these, but they mandate that they go to meetings. Why do you think they mandate that they go to so many recovery meetings? Because that's where the truth is. That's where the healing is. So the thing is, the meetings are so powerful. If you went and you sat in on an open meeting, it would move you. It would move you.
Ellesmere, 7 o'clock.
Right. But what I'm saying is, and even if these places go, you know what? They're scared of people like me in recovery. They say, we don't want you coming in carrying an abstinence message. You might mess with the economy. Doesn't matter, because the community of recovery is so strong that I end up in there anyway sponsoring. You know, through digital platforms that we got galvanized through COVID, right? Because COVID is not an excuse anymore. It's strengthened us. Matter of fact, I disagree with his statement. When COVID happened, we got in more facilities than ever before. We can minister in a way in treatment facilities that we never could pre-COVID. But we have to continue to come together. You know, so what can substance abuse treatment providers do to help connect men and women to recovery? Stop closing doors. Open up the facilities. Open doors. Make all things available. Stop with the hidden agenda, the economy, because it's exposed and it's obvious and it's killing our state. If you believe that people can change, because you're not working in the field because you think everybody's never going to change, you yourself have changed. You're working in this field, it's a thankless job because you're called to be there, because you have an experience that's galvanized you and qualified you to do some tough things. We're talking recovery. I got some moms in the room, lost people, ministering to other people and saying, look, dark is before the dawn. It happened, this ain't all there is. We're called on assignment through pain. And I'm here to tell you, in the big book of Alcoholics Anonymous, I give you this nugget. It says our family will give up on us, but psychiatrists and doctors will stay invested. You know why? The do-re mi. Let's talk about it. And that exposes our heart. I'm not in it for the money. I made 30 grand last year. I could not make another dollar and wouldn't care a day in my life. This is my assignment. I'm not going nowhere. I will be here for the duration. I will be here for the duration. And I will, in grace, tell people the truth everywhere I go. And when they're on maintenance, I serve in every facility. I say, I love you. You're the real you's in there. And keep coming. It's going to get better. Keep coming. Don't believe the lie that, hey, you can never heal. You can never be redeemed. Don't believe that. You know, and I always say, is this institution for profit? And they go, yeah, but how long is it? 30 days. Well, it takes 90 days of abstinence. These were educated people. 90 days of abstinence for you to apply one thing you learn in treatment. One thing. If you never get abstinent, your disease is running you. And that's a biological fact, physical science. It's an industry norm.
I think the best thing to do would to be able to help providers to help people connect would just be letting us in. Like going into the prison, not just going, like right now, the 12-step fellowships are finally allowed back into the institutions. However, I don't just want to go in there and do a meeting, you know, because you've got some people that are in there for years of their life. I want to go in there and be able to take them through this program of action or the steps or whatever the case may be, no matter what it looks like. Because I understand what you're saying. A lot of people are objectionable to the 12 steps, but there's a 12-step fellowship for absolutely everything. You know what I mean? They have a 12-step program for a person that's objectionable to the 12 steps. You know what I mean? So I would like to go to the facilities like in prison and do workshops. Actually, me and Zach and Greg are actually currently working on a program where we can present the steps, but not 12 steps, because obviously we can't go in there on a 12-step time, but in like a 6-step or 4-step portion to take people through this program to wake their spirits back up, right, and wake their lives back up so they can be effective wherever they are. Whether that's inside the institution, when they return home, be a representative in their communities and all that. So that's something that we want to get better at as well. That's one thing we have been lacking on, but I do agree that COVID was good and bad, but it was good because it allowed us to, I'll just be really honest with you, the 12-step fellowships in our state were horrible. Not horrible, but there was just a lot of talk of just going to the meeting, and not a lot of people were doing the 12 steps of the 12-step fellowship. But after COVID, things have revitalized, things have rejuvenated. There's been a huge spark in our area, and I'm watching it. And if you are on that end of things, and if you guys are engaged in the community at all, to deny that something is moving and happening in our community and in our state it's unbelievable. You can't deny it. You can't deny it. You are blind if you can't see it today. Something is happening through our community, and it's powerful to watch, and I'm honored to be a part of it. So we just, I think the best thing for us to do would be like to allow us in, just to give us the credentials to go into the places, certain, and select few, you know what I mean? Not like, you can't just let anyone into a facility, because number one in a facility is safety, you know, point blank period. But to let us in there to take people through the work and watch the impact that it has. I think that's our biggest, our biggest avenue to go would be inside the institution and watch the effect that it has, so they can give the evidence.
So before we open it up for
Because they'll
questions,
see it.
I know Greg wants to go, but I just want to let you know, it's already in place. In Newcastle County, we do 7 free events, we invite everyone out. Anybody that's ever been to one, I'll tell you. We invite MAT, methadone clinic, all the way to church and everything in between. And we invite the community out to experience the power of community.
We have speaker jams,
Well,
basketball events.
When we go in, and we haven't had one
Bowling.
politician attend, by the way. And when we go into treatment facilities and we meet them where they're at, and they come out and get plugged into the community, into the recovery community, they're the ones serving in peer-driven initiatives that were designed through the foundation, right, to help the next person. So I meet Jacob in a treatment center. He comes out and gets recovery. He has investment in state because he was in that facility. He goes back. A treatment center's strongest resource is their alumni, their evidence. So if you let us in and you get healing, what's the best advertisement for somebody to come to your facility? It ain't MAT, it's changed life, right? So that's already going on, and we are fundraising to change the culture to get a free 3 to 6 month facility in the state of Delaware. It's a huge task, and we're up for it. Okay.
So I just wanted to share real quick, because there's been a lot of talk on the 12 steps. I'm a product of the 12 steps, and there's a lot of misconceptions that 12-step fellowships are like some religious cult. You know, I've come in contact with people who have not worked the program because of the G word, God. You know, and that's completely okay, right? But I do want to highlight that if you're a human being, you got mind, body, and spirit, right? The only thing that we're saying in these fellowships is that third piece, that spiritual piece is sick, and it needs to be healed. And it's cool because once the spiritual piece is implemented into a substance use abuser's lives, they straighten out mentally and physically. We see it every day. Just because we don't like spirituality doesn't mean it's not effective. Just because you don't know you have a spirit doesn't mean it's not there. Notice I didn't say anything about going to church or religion or a denomination or anything like that, because that's not what this is about. This is about healing the individual, and it is absolutely up to the individual on what they would like to use as their higher power. We don't, when they come into the rooms and we get these individuals for treatment, we don't say, yeah, you got to believe in God. We don't say that, because that's not what this is about. They come to terms with that on their own.
They get honest.
They come to terms with that on their own.
Start taking them through the work, and that happens automatically. Something happens to them automatically. To watch someone go through an inventory process, and I'll explain it as brief as I can. Like, to go through an inventory process is one of the most amazing things. Like, for me, I see my dad.
You want to get questions?
Okay, cool. My dad growing up, I hated my dad. I didn't like my dad. I couldn't stand my dad. I wanted to cause physical harm to my father for the things that he did to us growing up. I do inventory and I find out that my dad did what he did because his dad did that to him. And then not only that, but I did those things to other people. And not only that, but I stole everything from my dad. I robbed my dad. I've been in the newspapers after I had committed a violent crime. I shot somebody smiling in the newspapers after I committed such a heinous act. And my mom and dad got to go to work and face their employers and their neighbors like that. So after I go through inventory and I realize that it isn't my dad that was the issue, it's been me. I caused all this harm. All the stuff I did to my dad today, me and my dad are best friends. Me and my neighbors communicate. Everything that happened in my life is unbelievable. So when people start to see this part in their life, they just automatically start to wake up spiritually. And whatever denomination, church, or whatever spiritual practice they want to believe happens automatically. We ain't got nothing to do with it. God does all that for us. And he works that out by just taking them through the work. So listen, we want to open this time up for you guys, man. If you have any questions, comments, or concerns, this is your time. We'll try to best answer them. And thank you guys for allowing us to be here and allowing us to do this.
Before we do open it up for questions, can we just give it up for our panel members over here? see you had your hand.
I honestly, I had a comment just go along with, the question of time, is it God, who is God, what is spirituality? And it really just reminded me of, I got a 21-year-old son in the system right now. I got an 18-year-old son who committed suicide last year. Couldn't get him help. Begging, pleading, change the system, change the system, change the system. So now I've got a dead child and a child in prison, and I myself came through the system here in Delaware. My son said, Mom, God, good orderly direction. God, Max Ephraim in the poem Desiree says, whatever you perceive God to be at peace with God. Whatever you perceive him to be. It's not a race for Christianity. It's not a race for Muslims. It's not a race for the witches. It's not a race. But our souls and our spirits are at stake, and people are suffering. The Bible does say my people suffer for a lack of knowledge. So humble ourselves and pray, and God will heal our land. This is Delaware. It is the first state. We are here to make a change because the woes are coming. And if we don't stand up and do our job and make change and make reform in our system here, many are going to perish, and many more are going to perish behind them.
Thank you for sharing.
More of the same model seems strange, doesn't it? Seems insane.
If you don't think what we're talking about could be effective, prove us wrong. Prove us wrong. Go out there, you guys are the people, man. Go out there, build these communities, and we'll help you. We'll do whatever we can, to get these things in place. These type of facilities are long-term, even 12-step based places, and how effective that they will be.
Just to the last point there just made, people here in this room are in corrections, mental health clinics, SUDS clinics, family members. A client to go get treatment service and get a good meeting. Of course, the next few weeks and months all stop meds. But that patient needs assistance / client with sorting out their current place to where they go to. So it's not a one-stop message. So thank you.
I would say solicit. To his point, we're always available. My phone comes on at 6 a.m. It doesn't go off till midnight. Ask my wife. We're always available. We give our life away. I'm just saying, solicit somebody's opinion. If you want someone to recover, you got a client that's struggling. If we don't have the experience to help him, we'll get someone that has the same exact experience and has recovered. And if you want to know what treatment centers to go to, we'll recommend the ones that have access to recovery. The ones that have more access to recovery will be higher on our list. The ones that say, they're all going to say they're great, right? They're always saying, we provide this, we got chefs, we got that. There's nothing new under the sun, okay? So if they have a good trauma program, if they have a good connection to resources, if the recovery community serves in there, they're going to be at the top of somebody's recovery's list. And always, insurance dictates, right? Insurance is king. But there are places that, if they're willing, they don't need anyone to go to. Like to the sister's point in front. Like there are places, if they're desperate, get to desperation. There are places that will take them if they say, hey, look, man, I don't care what it is, send me. They'll get right there. A lot of times, it's the choice that we give them, and they think they have a choice that keeps them from the quality of care that's available, right? Because they're sick. And if you give an addict a decision in their healing process, they're going to pick the easier, softer way, which is killing them already. They're going to look for comfort because that's what got them an addiction in the first place. And that's the fundamental truth that treatment providers are aware of. And it's sad, but we're responsible for their care, and we're giving them a choice, right? Because we're treating them like some other disease, and this isn't some other disease. This is a disease of mind, body, and spirit, and it runs deep. So we need to kind of take the reins and get some kind of oversight on what we do provide in our state. And who's going to do that? Your lived experience, right? But it should be someone that has recovered, should have some input. Even harm reduction says, hey, people that are in active addiction should have a say-so in their care, and in recovery should have a say-so in their care, even in harm reduction, in their principles, if you read their principles.
So I just want to follow up on what the gentleman said. Being a member of 12-Step Fellowships, we're not trying to convince anybody to come to our camp or stay away from another camp. We want to work with everybody. We want to be, we want to educate, we want to be inclusive, we want everybody to be a part of this journey that we're on. And one thing we do not do in 12-step fellowships is pretend to be something we're not. If an individual comes into a 12-step meeting, we're not asking them what mental health medications they're on. We're not asking them, are they on MAT? Because that's none of our business. What we do is we give suggestions and we talk about our lived experience. And for some reason, we become attractive to them. That's why they keep coming back.
The demonstration.
The demonstration of how we live our lives and our ability to help another individual who suffer from the same thing we suffer from is attractive to people. But we are not in these rooms behind closed doors giving medical advice or giving any sort of living advice to anybody. We are all inclusive. If you guys know people on MAT, tell them to come out. We will help them just as much as we will help an individual who's abstinent, because it really doesn't matter. That's not our job to, to dictate an individual's course of treatment.
Jacob,
Yeah, I have a great question, right? So, talked about earlier how, we need to keep the doors open, right? What do you think should qualify somebody to come in?
A desire to stop using.
Not to come in to help, the individuals that are already someone one of y'all. What do you think someone...
He's talking about Matt said just not anybody coming to the prison.
Right, yeah, he said...
Oh, yeah,
anybody,
so... Okay, so the qualification would absolutely be, someone that is, for an example, myself that's been in the prison system my whole life, they know me. Like when I go to the prison, like Warden Emmett was like, I seen your name on the list, and he was like, I had to look on the screen to see if it was you, and he's like, damn if it ain't Anderson, And he comes out, the guards there know me, Shade know me, they see me and they can see that something happened to me. For instance, Zach, and you'll know it because we will recommend them. And Zach, me and Zach were doing this thing for a Mommy and Me house, right? We were doing some completely altruistic stuff and selfless stuff to try to help the Mommy and Me house. We go over there and this guy drives by on a bike and he's riding by. This is what brought me to Delaware. He rides by on a bike and then he stops. He goes, Matt. And I was like, yeah. He was like, yo, man, whatever you're doing, keep doing that. Like, we don't even have to say anything. People can see it. It's a demonstration of how we live. That's what makes me so useful in this community, because I wasn't like a wallflower in our community. I was an animal in our community. I was very well known, and not for good things. But now that I've changed and something happened to me and I'm able to be effective, now everyone's like, yo, what happened? All the same people that I grew up with, most of them did, but the same people that are around, they're like, yo, what happened to you? I want that too. Show me. And I'm able to guide them and not just say, oh, hey, just go here, go to treatment and you'll be fine. No, I'm able to guide them through the process to help them recover in recovery and go out and help their communities as well. I watch, and it happens to me regularly. There's people in the room that know me, that know what I do, and watched it happen to the people that I've worked with. It's unbelievable. And it isn't like, oh, look what I did. It's kind of like, yo, look what God did through me to this individual, and look at him go. I'm just watching like, yo, it's nothing like watching the lights come on in somebody else's eyes. Nothing like it.
The self-help community generally gets people with more years of experience, though, right? Like people who
Absolutely.
work the steps and dig spots.
Yeah. That would be a big thing. With you have to be through the work and have had this awakening, and you'll know it. It ain't like somebody's running around still trying to impress everybody. It's someone that's just really trying to help other people.
Anything else before we close? We want to thank you guys from the bottom of our hearts. Doesn't go underappreciated. We have been in prison. We've been on probation. When I got off probation, I thanked my probation officer. I went and sought him out. And I said, "You remember me?" And he said, "Yeah, I remember you." And I said, "Oh, thank you. You helped save my life." So believe me, I know you don't hear it enough. We love you guys. We value you.
Thank you.
Thank you.
And if you're one of them people, thank you for saving my life. Straight up.